Hi, Mrs. Johnson. I'm back. I have all the supplies to give you your Javity 2 feeding. The doctor has ordered 2 cans of Javity every 4 hours, and I got all the supplies for that. So basically what I'll be doing is I'm going to take your nasogastric tube, I'm going to flush it with the water, then I'm going to add the Javity 2 cans, and then I'm going to flush it with the water after it. So this is called bolus feeding. You'll be getting that every 4 hours. Okay? Do you have any questions? No. Okay. So we want to make sure that whether we're feeding continuous feeding or bolus feeding, we have to assess the abdomen. We want to check the bowel sounds. We also want to check the abdomen is not hard or distended. We also want to check that the patient doesn't have pain, and check, active bowel sound, hypoactive or hyperactive. Okay, so I have already done that. Okay, so now here's the supplies to give bolus feeding. Okay, so I have a pair of gloves. The gloves don't have to be sterile. I have something to protect the bed so I don't spill it on the bed. I have my 2B syringe, 60 milliliter. The doctor has ordered 30 milliliter water before giving the tube feeding Javity 1.2 to flush the tube. And then I'm giving 2 cans of Javity. I have already put the Javity 2 cans in here. This is my Javity 1.2. And then after I give the tube feeding, I'm going to flush it with 30 milliliter water. So you have to check all this, the amount of water you're going to flush with before and after tube feeding. It should be written in doctor's order. Okay? So what I'm going to do now, first of all, I'm going to make sure I put this on the bed to protect the bed so I don't spill anything. Okay? The other thing you need to do is you need to make sure that the tube is in the right place. So I already shown earlier that what you do is you inject air in the nasogastric tube and you listen for bowel sounds. But I will show it again. So basically you take about 15-20 milliliter and you listen at the abdomen epigastric area. You can inject air and you should be able to hear bowel sounds, gurgling, if the tube is in the right place in the stomach. Okay? Or the other thing you can do is to check is withdraw some fluid and test it with your strip. If the pH is 4.1, it's in the stomach. Okay? Those are the 2 ways you can check if the tube is in the right place. So you must do that before you do the feeding. All right? Okay, so now the tube feeding bolus should always be given by gravity. It should never be pushed like this, okay? You never do that, always by gravity. So I'm going to pinch it here so the patient doesn't get any air. It's pinched, okay? So pinching it here. I put my 2B syringe like that. You see I'm not using the plunger because it's by gravity. So I put 30 milliliter of water. So you see it's still pinched. That's not why it's not going down. So I got to get ready my tube feeding, my Javity, the 2 cans. Okay. So as I'm putting it in, it's going the water. I have to flush it first. 30 milliliter water, doctor order, and then I pinch it again, and I put and let it infuse by gravity. You doing okay, Mrs. Johnson? Okay, she's doing good. Okay, there's my Javity going by gravity. Sometimes you can raise it up, it goes faster, but about here is fine. Okay, you want to give it slowly. Never use a plunger. Okay, there it goes. Okay, good. It's going well. So this is called bolus tube feeding. It could be ordered every 4 hours, it could be ordered every 6 hours. So the main thing is as the tube feeding is finishing, you want to pinch it so patient doesn't get any air. So I'm going to add some more, and that's done. Almost done. squeeze a little bit. And I'm going to get ready with the 30 milliliter of water. You always want to flush it because it can get blocked. You know, the tube feeding formula is thick. And if you're giving medication, it'll be same thing. You always want to flush it at the end. Okay, see, it's all in. Now I'm just going to flush the tube feeding. Okay, we're done, Mrs. Johnson. All right, that's done. Okay, it's all given. And this is how you do bolus tube feeding. And then you just put the, the plug back so the air doesn't come out or the liquid doesn't come out. Okay, you did very good. And that's bolus tube feeding.